For those of you who aren't familiar with me or with the DPA, my name's Elizabeth. I'm Chief Executive of the Digital Poverty Alliance. We are a registered charity working across the UK with the goal of ending digital poverty once and for all in this country. I'm very excited today that we are going to be discussing an area that the DPA is doing quite a lot of work on at the moment, and we've got some fantastic panelists as we talk about inclusion as infrastructure, how digital access is transforming health outcomes. So I'm just going to ask our panelists to introduce themselves quickly and in no particular order. So Mark, I'm going to pick on you first.
Good afternoon, everybody. My name is Mark Burton. I'm the Health and Social Care Lead here at Virgin Media O2 Business. And my role here at Virgin Media is to support the NHS and social care with their connectivity, both from the hospital perspective and also from the community perspective. So a lot of our work is also supporting digital inclusion. I'm really looking forward to the conversation this afternoon.
Brilliant. Thanks so much, Mark. Rachel.
Hi everyone, delighted to be part of the webinar today. I'm Rachel, I'm the Senior Digital Inclusion Officer on the 100% Digital Leads programme. As the name suggests, we're based in Leeds. We're based in the Integrated Digital Service at Leeds City Council, and we lead digital inclusion for the city. We work with partners cross-sector to develop digital inclusion interventions that meet the needs of communities.
Amazing, fantastic, and 100% Digital Leads do some absolutely incredible work, so really looking forward to hearing from you. And Meryl.
Hi everyone, I'm Meryl Mullins. I'm working for NHS Greater Manchester. I'm the Senior Primary Care Digital Facilitator Team Leader, and we work with the practices in Greater Manchester trying to improve their digital access, and a lot of our work does include digital exclusion because in a poverty area it's a high point in our area. So looking forward to today's chat.
Fantastic, and great to have you represented along here, Meryl. I think it's going to be a really good chat that we have today. If you are joining us live today, please do use the chat function. Let us know your name, your organisation, whereabouts in the UK or indeed anywhere else you might be. Let's get that chat going. If you have a question that pops into your head during the webinar, don't wait until the end. Do use the Q&A function, which is down at the bottom of the screen, and pop that in there, and hopefully we'll have some time to come to some of the questions at the end of the session, and we will finish promptly at 2. So just to kick us off, Rachel, Leeds has really embedded digital inclusion into local health delivery using very strong partnerships that you've developed. What have been some of the most effective strategies that you found in reaching those who face barriers to digital healthcare?
Yeah, we've been doing quite a few, obviously, initiatives. The programme's been running 7 years, I should have said actually as well. So lots has happened over the last 7 years. We have, over the last 2 years, developed the community-based approach model. You may have seen this. I'll share the link so that can be shared. That's definitely something that might be worth having a look at. And in doing that, we've kind of used it as a model to be able to bring partners together with the concept that everyone has a role to play, but very understanding that in every different sector, different team, different community, what that role looks like is very different based on capacity, resource, funding, and that's been really successful. And what we do with that is bring those organisations together. So we've developed a number of networks, bringing organisations together to be able to share best practice, share resource. We've developed a Google Drive with lots of resources on there to try and sort of avoid reinventing the wheel, and obviously inputting into the digital inclusion toolkit as well to be able to signpost people to support. With the health trust in the city, we've been doing a lot of work. I lead kind of our health area of expertise to be able to kind of bring the third sector organisations in the health sector together to develop partnerships. And that's been really successful with one kind of health trust in the city at Leeds Community Healthcare. So really looking at kind of how they've embedded digital inclusion into their strategy, but with a real focus on the workforce. So really thinking about, you know, the staff confidence and skills across health settings, knowing they've got a lot of pressures and how fast-paced digital is coming through to be able to offer to patients. Actually, we've noticed a massive gap within that, you know, staff have the training potential on the tool, but not on how to have the conversation with people. around where to signpost to support in the communities, or to actually better understand their digital inclusion barriers. So within our kind of partnership working, we've kind of brought those third sector organisations and health sector together to be able to work more closely at kind of understanding the need, and then being able to refer and signpost to support in the community to support the need. And in that, we've developed a community support directory, which has been fantastic and is a really great referral tool now for all services across the city to be able to use it as a point of contact, to be able to look at where in the city is offering digital inclusion support, and that might be SIM gifting, equipment lending or gifting, at home digital skills support, you know, in centre digital skills support, and being able to have more meaningful person-centred conversations with people around what their individual needs are, and then looking at where best to signpost people to support based on those individual needs. Lots more examples, but I think that's mainly kind of around the partnerships, that community-based approach, bringing those organisations together. And then just finally, I think most recently, like organisations we've been chatting to, you know, some might say, oh, we don't need to do digital inclusion because nobody's asking for support, no one's asking for help on the NHS app, so why would we, you know, run a session? So we've been doing a lot around those organisations saying just because somebody's not asking for support and help doesn't mean that they don't need it or would benefit from it, and changing that culture there, and looking at kind of that embedded approach of that light introduction of digital rather than just thinking it needs to be digital skills sessions. And we're doing a lot of work around that, because for where people are going, oh, we don't need to do anything around digital inclusion because no one's asking for any help, actually having more open conversations with people around, you know, how digital might be an enabler and might benefit them, and obviously bringing those partners together to discuss that and collaborate.
Fantastic. And I think it's so true. Actually, people don't know where to go and ask for help, and they don't always entirely know exactly what the help is that they need, which makes it very difficult for them to reach out. So yes, it's so important to take that kind of proactive approach. And indeed, it's not always just the app. There's lots of other elements around digital healthcare that don't necessarily get quite as much airtime. And Meryl, I mean, you're working in NHS primary care. How do you balance the drive for digital first services with the reality of unequal digital access?
So just looking at it from a Manchester perspective, we kind of try to take a proactive and inclusive approach, recognising the transformative potential of digital tools and the structural barriers that many patients face. We started to identify who is actually digitally excluded. And according to Manchester's Digital Inclusion Action Plan, around 1 in 3 households experience some form of digital exclusion. So this mainly disproportionately affects the older adults, disabled individuals, lots of groups, those without reliable broadband or the digital skills. So we're trying to ensure that digital skills are never the only option. They're just part of a broader inclusive offer. We've also embedded digital inclusion into practice culture by training staff to recognise and support patients with digital barriers, provided printed guides, one-to-one support for use with the app and their online services, signposting to digital health hubs and community drop-ins where patients can build the confidence and skills. We have a lot of support from Manchester City Council with that. And at the same time, we're just trying to champion the benefits of the digital for those who can access it. And hopefully this will reduce the administrative burden on some of the staff time within general practice. But also we want to improve the patient engagement. But what we've got to do is assume that digital isn't right for everyone. So the offers for patients, you've got to provide choice in how services are accessed, continuously monitor the uptake and feedback, and adapt the approach. So basically, digital first doesn't mean digital only, but it just means leading with digital where appropriate and trying to ensure that no one is left behind.
Definitely, and that choice element and empowerment element is so important, because actually if people feel like they're being forced to use digital, and let's be honest, in some cases it really can feel like that's what's happening, that's only going to detract from all the efforts to help people actually find the benefits for themselves. And Mark, from an infrastructure perspective, how do you feel telecoms and tech providers can meaningfully support the NHS's digital transformation goals whilst also addressing exactly these inclusion gaps?
Yeah, it's a great question. I mean, when we look at the infrastructure, digital infrastructure, I think it was mentioned by the current Prime Minister that, we've got to get the plumbing right before we turn the taps on. And when he talks about digital, and he's absolutely correct in the fact that nothing will happen unless we have the right infrastructure in place. And that's not just within the fixed environment, so in terms of a hospital, but what we're looking at from as a provider, solution provider, is providing digital access beyond the hospital walls and GP surgery walls and actually into the physical hands of the patients and the care providers. And as we move forward, that is exactly what we need to do to sort of support the NHS and to support population health. But to do that, there's no point just building the infrastructure and putting it in place and then walking away, because that's not actually helping anybody. We also need to be able to support them. So if you use the analogies like giving somebody a car but if they can't drive, is pretty useless, right? And it's the same with digital and that digital infrastructure. We know from some of the work that we're doing, we know that 21% of the UK population don't have the basic digital skills. So that's going to make a massive impact in terms of the people, how they access that. We also know that actually the people that are more deprived, and I think Meryl's already mentioned this actually, that those that are living in areas where the challenge through cost of living has a detrimental effect on their health, but also a detrimental effect on their ability to access digital services as well. So as a responsible provider, as a responsible partner of the NHS and the social care, we work really closely with a number of projects that we can discuss during today, such as providing digital skills support through our Connect More programme, and that is everything from showing people how to get online and use their digital services, right through to more recent work that we've been doing to support the NHS app. And again, Meryl, you'll be familiar with the work that we've partnered with in the Manchester area, where we were supporting patients get online to the NHS app, and it's had a massive increase in the number of repeat prescriptions that are ordered through the NHS app. So it really does work. So in the initial period when we were doing the work with the Wythenshawe Medical Practice Park Medical Centre, a number of repeat prescriptions increased to 352 in that period of time. That gave back that actual GP practice 17 hours of time back, just because more people were using that NHS app to order repeat prescriptions. So that's just one area. We also provide the national data banks, so we have free data sims that are available. You may have seen these during Christmas. We tend to advertise that really strongly on the TV during Christmas, that people that don't have data access and it's too expensive for them, they can actually go and get free data from any of our O2 stores. We zero rate over 60 different websites, both health and non-health related. And these are some of the examples of what we can do to provide. And more recently, hopefully everyone's seeing that with in partnership with other providers such as BT, we're doing a real big drive at the moment regarding digital switchover, where people that are on the old copper line, the old analog lines, and moving across to digital services, it is to ensure that that's happening, is that they can contact the provider and get support with that switchover, to ensure that when the old copper lines get switched off, that they aren't left stranded and left alone. So that's another idea of where we can really sort of support the community and support patient care.
Some fantastic, really concrete examples there, Mark, and actually sort of really drawing those strands together and demonstrating that actually, exactly coming to Rachel's point earlier, if you provide people with the help, they'll come and they'll find it, and they'll see that it can really actually create a lot of benefit for themselves. And I guess really potentially at the fundamental to all of this is that digital inclusion isn't just a social issue, and it's certainly not about getting people online just for the sake of getting people online. How do you all feel that this is really a critical enabler for better health outcomes? Because it's certainly something our research has shown. Mel, maybe do you want to kick us off on that one?
Yeah, I'm happy to do that. Hopefully, with the digital inclusion, it can ensure patients can have timely access and interventions, for example, in managing their long-term conditions, and stay connected to healthcare, especially those more at risk of poorer outcomes. when patients are digitally excluded, they're not just missing out on convenience, they're missing out on the timely care, informed decision making, the ability to manage their health. And in Manchester, we've kind of seen that firsthand, how digital exclusion compounds health inequalities. For example, in our locality, 63% of residents aged 75 plus and over half of disabled people are likely to experience at least one form of digital exclusion. So we're doing a lot of work around this, but these are the same groups who often have the greatest health needs as well. So it's important that we include them. If they can't access online consultations or the prescriptions, they're more at risk of poorer outcomes. So when digital inclusion is embedded into primary care, hopefully through the staff training, through the work that we're doing with practices and patients in the community, we can hopefully build these partnerships and become a powerful enabler in a sense. And again, like partnering with Virgin Media and other Good Things Foundation, we've done a lot of that in the locality. Hopefully patients will gain access to the services at times that suit them, hopefully managing their conditions and being able to access the healthcare without delay. They can engage more confidently and consistently. So hopefully this way going forward, it will be a better outcome for the patients.
Amazing. And Rachel, maybe do you have some thoughts on this too?
Yeah, well, obviously similar figures in Leeds around, obviously the statistics, but also just interested thinking about kind of the hospital admissions around like self-management apps. We're doing lots of work with some of the community healthcare teams, and a lot of them were saying like the long COVID team, the weight management team, the things we're offering mostly at appointments now are digital interventions. This is where you'll find the information to be able to support you. This is an app, for example. It's just so much more common. There's a lot more things online that people will be obviously needing to support with their long-term conditions rather than offline options. So definitely support around that. But also thinking about kind of the staff confidence around being able to have that better conversation and actually explaining obviously the benefits for somebody in doing things digitally for their healthcare. And a lot of that isn't always the transactional things. Obviously, yes, the transactional things around like the online consultation, NHS app, for example, but also around those holistic things as well, around those personal motivations. Actually, just the benefit of a snooker app for your mental health is amazing. And we've found that with the third sector, doing that person-centered approach, the health tools might not be the first thing somebody does online, but finding their personal motivations, the increase in their mental health, reduction in their mental health, sorry, should I say, increasing obviously supporting their mental health by doing those things that matter to them and are meaningful to them is just as important as the transactional things to obviously directly support them in obviously managing their healthcare and interacting with the primary care and secondary care services. Really focusing again, just thinking about care with carers. Done so much work with carers Leeds, and they were saying, thinking about where they're at a disadvantage, where if they can't use digital, being able to manage not only their own care and health, but the person they're caring for as well. It's just added pressures. So obviously, a lot of digital inclusion work is being done around supporting those community of interest with those additional barriers as well.
And making sure people can access what's right for them, whether it's coming on
Absolutely.
a webinar like this or, as you say, using a gaming app, actually whatever works for different people and what they need to feel, like their well-being is looked after. And Mark, I mean, coming back round to you, how do you see sort of digital inclusion and the connectivity that VMO2 provide as really enabling better health outcomes?
Yeah, I think it's fundamental to to healthcare moving forward. It's we can't escape that, and neither should we. We should embrace this, and it's connectivity, be that mobile, be it fixed, is absolutely the future of healthcare. We couldn't build hospitals quick enough to cope with the capacity that's required. We just can't. But what we can do more quickly, we can build up the capacity from a digital perspective. And there's a significant efficiency that's available to the NHS for that. And they've demonstrated this themselves through their studies. So we talk a lot about supporting the patient outside of the hospital environment, but we can support them through that whole care pathway. I mean, for one example of that, King's College in London, they did a study funded by the NHS actually a few years ago using a contact centre to support patients, a very, very specific group of patients that were going for colonoscopy. And during that support, they supported the patient digitally to remind them when to take the preparation prior to admission for their colonoscopies. They actually reduced the didn't attend by 28%. So the efficiency that was giving that hospital trust just on that one particular group example was over £300,000 in the number of in terms of an efficiency saving, because people just came when they were supposed to come. When they came, they were ready for the procedure as well, so they don't have to send them away and things. So there's significant efficiencies that is available through digital, both from a outside a hospital point of view, but also from an inpatient perspective as well. And if we can just get that a little bit more seamless transition from the community-based care through into the secondary care as well, and then out into the social care, it'll add an immense amount of improvement to the efficiency of the NHS across the whole healthcare ecosystem, not just in one particular area.
Incredible. And it really does show actually what some of this can do to free up capacity in our health service. And Mel, I'm going to come back to you, and I'm going to contextualize this question. So we did some work with Deloitte on the socio-economic case for tackling digital exclusion. And one of the really interesting things that found was that 25,000 lives a year of over 65s could be saved by helping that population get online, access health information, have digital skills. I'm putting that context in because I think the next question from Mel is, what challenges have you encountered in encouraging digital uptake? And so whilst choice is incredibly important, there's also a lot of benefits to be found by getting people online. So what challenges have you particularly found, Mel, in Greater Manchester, and how have you addressed those in a way that empower people?
There are a lot of benefits for patients to be online, but how do we encourage that and how do we improve that? I think in Manchester specifically, we've seen the constant challenges are the confidence and the skills, obviously we've talked about already, access to the devices and the connectivity, and the trust and relevance. Some people just don't want to go online by choice. So it's how do you actually encourage them patients to get online? So a lot of people do actually lack the confidence when they're using the digital tools, and they want it the old way. We just like ringing up, we just like walking in. So it's how do you change that? But digital poverty just is a massive issue. A lot of patients, they don't have the smartphones, the plans, the SIM cards, or even stable internet. For even children to do their homework sometimes. So a lot of schools in the area now are actually going to this as well. So how do we see the value in digital tools? How do we prove that to patients when they're worrying about the privacy and the data security? Because obviously there's a lot of scams out there. What we've tried to do is work with the community. If we work with the community, digital health hubs across Manchester, they offer hands-on support and training in trusted spaces, local spaces, in the community centres, in the hubs. And they can provide the SIM cards and often reconditioned equipment, either for free or at a low cost to the patient. So we've got that service within our localities. I'm working with companies like Virgin Media. One of our practices in Manchester, Brooklands, they did an NHS app training event, initially supported over 100 patients in just getting onto the NHS app. And they started off with Virgin Media, but they're actually carrying that on now themselves within the practice. And with feedback from the patients and just adopting their approach, the patients were advising, well, yeah, this is good having a session, but we want more time. We need, a bit more help. So what they're doing now is they're continuing offering the help and the follow-up, but they're offering staggered sessions and refresher visits for patients. So it's not just, oh yeah, get on the app and go away with it. If you're stuck, come back to us. So it's just providing that continual support and just encouraging that with the patients, and just to build the confidence, the skills, and just, obviously it's important, but we've got to be able to inform patients that in the proper, correct manner as well.
Absolutely. It's so important that, you know, a one-off intervention can be great for some people. Actually, they just need a little bit of help. But for others, that ongoing face of support can be critical if you don't actually have anybody else maybe in your family or your immediate community who can do that with you. And Rachel, how have you found in Leeds that actually the collaboration between charities and healthcare professionals has really changed the way that digital skills support might be offered in this setting?
Yeah, absolutely. I mean, firstly, you know, a big challenge we've seen, you know, consistently has been tools being rolled out and then digital inclusion kind of thought about at the point when it's like, oh, people can't actually use it. So we were kind of been working more closely on building those partnerships where brought in digital inclusion is thought about a lot earlier within the rollout plans of some of these tools. So we've got like Patches in the City, which is like a new interaction primary care tool, for example, where the practices and the PCNs have got implementation tool, building digital inclusion into that rather than kind of rolling it out and then picking up the pieces around, oh, actually people need support around this. That's been really successful with Leeds Community Healthcare specifically, as I mentioned earlier, kind of the focus on the workforce, but also kind of on information webinars. So something that we've kind of developed is actually all of these community hubs. Obviously, we've got digital health hubs in community settings similar to Manchester. They're the places people go for, you know, for support. They walk through the doors and that's the place that people will go to in the first instance. But a lot of the time, there isn't the support for those people and the staff and volunteers at those organisations on the actual tools. They're winging it most of the time when we're chatting to them and saying, oh, we'll have a little look at what text message you've got and what you actually need help with. There hasn't been that kind of, you know, drive from the primary care and NHS trust to actually provide that information for the third sector in most cases. So I'm really trying to kind of change that in Leeds and actually bringing them on board to work with the third sector at the earliest point to be able to go, we're rolling this tool out in August. This is the rollout plan. You're likely to get people coming in your doors saying, I've got a text message, my letters are going online now. This is the walkthrough of how to do that. This is a how-to guide. So it's a lot more collaborative. It's a lot more, you know, concise, and actually it's really focused around the needs of the people that are needing to use these things as well, rather than just it's coming, actually it's coming, but this is how you use it. And that's worked really well. So we've done an NHS app one as a collaboration with the third sector and the health, and we've just done one on digital letters and the platforms at Leeds Community Healthcare. And the third sector found that very useful and just, you know, really great that they want to provide that capacity, knowing that they're not going to be potentially the people that are helping people use these because they haven't got the capacity. They're promoting and raising awareness. Ultimately, the support comes from the third sector. That actually, in the smallest sense, they are actually just saying, here's an information webinar about it. And obviously respecting that third sector ultimately are the places that people are getting that support. So that's been really successful. And obviously, you know, bringing the VMO2 Connect More programme in Leeds has been fantastic. And we're really grateful to work with Freya and the team on that. And that's been a really great additional asset to sort of think outside the box around where you actually deliver digital skill sessions and thinking really about the settings that they're delivered in. You know, being in comfortable settings, places that people have trusted relationships is really key, thinking about those additional barriers, and also really working with lots of organisations that support communities of interest where they've got that understanding of people, you know, with a sensory and physical impairment or people living with a learning disability or a language barrier, and then have that extra expertise to be able to maybe translate some of the resources if there is a language barrier, and being able to kind of have a more meaningful conversation because they know that person's additional barriers. So yeah, that's kind of a big focus, obviously, but really successful on the journey of bringing those VSE and health partners together to collaborate and co-produce interventions rather than it just be one service is rolling the tools out and the other one's ultimately picking up the pieces and providing the support with very limited capacity, actually collaborating. And we're looking at, you know, funding opportunities as well where there can be collaboration and building in that wraparound support into the rollout of digital transformation and innovation.
And I think picking up on some of the comments in the chat, yes, this partnership working is absolutely essential. It's at the heart of the Digital Poverty Alliances around businesses, public sector and charities and voluntary organisations working together. But there does also need to be that funding, and it's great that within Leeds, that's something that you guys are able to look at, and hopefully that's the kind of thing that as the Department for Science, Innovation and Technology continues their digital inclusion work, and with their innovation fund coming, this is exactly the kind of work that needs to see that long-term sustainable funding coming through. And I'm maybe going to come back to Meryl for the next one. I mean, we've talked a little bit about some of the barriers. So we've talked about connectivity, we've talked about devices, we've talked a bit about skills and motivation. What do you think actually are the single biggest barriers for people who are struggling to access digital healthcare today, right now?
Right now, I think there's a lot of barriers, and then we've obviously all touched on the barriers that are out there. But I think just as important, we need to address the infrastructure that is within there. Like Rachel's already touched on, you know, a lot of these things are brought out, and then it's, oh, let's think about digital inclusion afterwards. You know, it needs to be included from the beginning, you know, whether it be the elderly, disabled, you know, mental health, there's all different, the homeless, there's all different areas out there. They lack the practical skills to use the digital tools really going forward. And a lot of them are just like, just fear of getting it wrong. We've already mentioned the scams. You know, if I'm on a computer, I just press every button until I get it right. You know, I know I can't break it in a sense, but people haven't got, it goes out the window sometimes, but people haven't got that. They're just afraid of getting it wrong. So, and then we've got those that just don't even see the value in the digital health services, you know, like, but they're online for, I don't know, Facebook, you know, all the other things, but with healthcare, it just seems to be so far behind. Seems a lack of will a lot of time, and it's trying to get that lack of understanding about the benefits for the digital tools, that they are, you know, they are a benefit for them going forward. I mean, obviously, we've got the cybersecurity, you know, there's all the data privacy, there's all that sort of worries and concerns as well. So I think the main thing that Rachel's pointed on, I've just mentioned as well, that a lot of these platforms are just not designed with accessibility in mind. And the biggest one here, for example, is NHS app. It's only in English. It can't be translated. And in Manchester, we specifically, you know, have a high proportion of people who speak other languages. So second language. So they often find it really difficult to use. So we're not taking that into account when we're building these tools. So I think we just really need to have community-based support, because we went out to the Huayin Centre, Chinese community, and once we were there talking to them, they were quite happy to take on board the NHS app, and they were translating for each other for those that didn't use English. But we managed to help them and support them in just being able to order the NHS app prescriptions. So, you know, it might only have been a small community of 30, 40 people within there, but you come out with some sense of achievement. And I think that does really help. But I think the biggest thing here as well, we go around to all the practices. We've got 82 practices in Manchester. Not all the staff are confident as well. So we're trying to support the practices in training them with the NHS app, with digital inclusion. We've just got a new package. We've got lots of guidelines there. So it's really just supporting the practices and the communities with all the digital tools that are there. So hopefully, if we can support them, it will increase the uptake of the digital tools going forward.
And it's so good when people are helping each other to be able to access these tools. And certainly I've seen a few things around digital champions. Rachel.
Just a quick one, I'm conscious of time, but yeah, just also you might have seen just on the barriers, the Good Things Foundation recently published a really, really great leaflet on beliefs and trust as additional barriers to digital healthcare. I think it's fantastic. So being like working with third sector organisations around using that, and I just thought it's got some really valid points, just the way it's explained about kind of people's main concerns and fears. I think someone's put that in the chat as well, around, you know, like where your information goes when you're using some of these digital tools, and, you know, thinking about that kind of, is it a slightly different offer? It's not as personal because it's digital. It's not as meaningful as a face-to-face. So just the way they've set it out in the leaflet, if you haven't seen it, I'll drop it in the chat for everybody. But I just thought it was a really nice, simple way to explain just some of those additional barriers that people find around engaging with digital healthcare.
And Mark.
Yeah, hi guys. I just want to reiterate a point. There's been a lot of discussion here about sort of access and affordability and such like. So I just want to clarify one more time actually about the benefit of the National Data Bank. Now, the National Data Bank is something that O2 and all our other competitors, so 3, Voda, have supported and come together and supported the National Data Bank. So there's over 61 million gigabyte worth of data that's available. And all people need to do is go into any of the O2 stores or of the other stores, and those SIM cards are available for them. And the means testing isn't that stringent. I think you can pretty much walk in and get that data. That's something that it's an absolutely underutilized resource. So I would really encourage people to either come and speak to us, or other providers are available, and we can support that as well, because it's a crying shame really that data isn't used, it's not utilized. So along with recycled devices that's been mentioned as well, we can really support the communities that are struggling to get online in that particular respect. So please do reach out to your providers and hold our feet to the fire.
I think you can never offer people enough times where support can be located. Just staying with you, Mark, what do you think effective industry engagement with the health sector looks like in practice? How, apart from SIM cards, how can commercial partners really be adding value without driving inequity? How do you strike that balance?
Yeah, it's a great question, and I think we'll never capture all in the short term. We'll never capture all of this. It's about making some of the smaller gains up front. I mean, we do understand that that the lack of that digital skills actually contributes to people's stress and anxiety. So it's not for everybody, okay, and it might not be for everybody. But what we can do, we can make some smaller gains, and I think it's really important that whether in whatever the public sector you're working in, when you're engaging with your supplier, consider what added value and social value really looks like, and actually go and have those conversations. And you'd be surprised actually how we can really help you shape what's suitable for your particular community and what that might look like. And with ourselves, we have lots of offices and places like that, such as that across the different regions, that can be utilized, as well as training resources as well. So there's always opportunity to do more. And a lot of the organizations such as ourselves, in the public sector, there should be a 10% weighting on any of the tenders for social value. I think it's a shame that actually only 10% of that's used. Consider how you're actually wording those contractual commitments and what you can really get from your provider, because we're always looking to be best partners, not just to people that we provide, the organisations that we provide that connectivity to, but to your end users as well. We're passionate about that, as passionate as everybody else. I have a healthcare background, so I'm super passionate about it, right? I live and breathe it. So yeah, we really are trying to support you and the patients, and let's have those discussions and also ask the communities, how can we help? What would work best for you? Because we can adapt and come up with different solutions and resources that can support that digital inclusion.
And I endlessly love having VMO2 business come onto webinars, because you really do, as an organisation, bang the drum for social value and just what this can provide. And it seems like it's a little known secret that some local authorities, some health authorities, other public sector bodies don't always realise. This is a great way of leveraging funding and capacity within your area. So if you're sitting there right now wondering what this is, really think
about it. This is an expansion of what looks good for the taxpayers' money, and let's bring it down to that. There's an expectation in the public sector and the charitable sector as well that you get best value. Best value isn't always about making sure that you get the lowest possible price. Price is super important, but it's not just about price. It's about what does that total wrap look like, and what does that support look like.
Absolutely. It's so important, and it is such a good way of making sure that this funding goes into something that will be sustainable, where actually you've got very large businesses who are able to actually throw a bit of extra resource behind this as well, as well as just the funding that comes with it alongside that. Meryl, we're going to turn back to you and look at this from a sort of slightly different perspective, which is around media literacy and misinformation. And we know that misinformation is a growing challenge, especially online with the rise of social media. How can trusted digital health resources be better promoted at practice level so people know where to go that's reliable?
It's a really good question. In Manchester, we're literally attempting just to get trusted resources into everyday care, through staff conversations, the posters, the campaigns that we're doing, and digital champions as well. So we are trying to make this part of routine care. So just for example, when patients come in for appointments, staff are encouraged to signpost them to the NHS app, all the links for the NHS. And if they haven't got the literacy or they need extra skills, then obviously they've got the local digital health hubs that the council have provided across the community. But most of our practices actually do have digital champions within there in-house, and they're working directly from the practices within the practice staff, trying to help patients access in real time and just explaining to them, just giving them the time that they need to be able to learn about what is available to them, whether it be the app, whether it be these online consultation tools. But there's lots of tools that they're using, just the posters and the waiting room screens, social media. They're trying to promote the trusted resources, because obviously if you hear something, there's lots of whispers around. It's better to get it from from the people that know. So the training, we've got to keep it simple and keep it aligned with the national campaigns as well, but what's local to our area. We've also, like with our local hospital, they have their own app, which is really confusing for patients, because the GP has one and the hospital has the other, My MFT. So we're trying to co-brand the materials and the information and provide it at the same time for the patients. So I think confidence is really a key issue here. And this year, through our QI digital project that we have for all practices, whereas we've had maybe 30 or so digital champions in the past couple of years, we've actually asked all the practices to nominate a digital champion this year. So they'll attend monthly forums with us, receive updates on the trusted tools, how to promote them, and get support from each other as well. So all the practices are actually working together in the locality. We also, as digital facilitators, there's a team of us in Greater Manchester, but we provide guidelines for practices, whether it be the cloud-based telephony, their online consultation. So we kind of get a frequent answers and questions that we can support for the practices, just the common questions that come up through all these services. So we're trying to get practices to identify the patients that are digitally excluded and underusing the services so that they can offer more support. One of our practices, again in Wythenshawe, it's a different one, Cornish Way, they reached out to their patients who specifically 40 to 80 who weren't using their online services. And then they were just offering the one-to-one help with their NHS champion. But they work with the voluntary organisations again, and we can't thank Virgin Media enough. But within this year's QI project as well, digital inclusion is our main area, and we found literally the submissions we're doing yesterday, a lot of our practices are volunteering to become data banks as well. So that's really good that we're getting that through the Manchester area. It's just trying to get that trust and keep the same message going through really to everybody.
I think it's perhaps one of the real benefits of Manchester being, I think it's the most digitally inclusive city in either the UK or possibly Europe, is that actually there's a lot of interest and awareness within Manchester and within the Manchester community. I think we see that in Leeds as well. And of course, different areas face different challenges. Mark, coming back to you, and you mentioned your background in the health sector. How do you see cross-sector partnerships really evolving to support integrated care, which is kind of where everything is heading to? How does the public, the private and the voluntary sector need to work together on this?
That's a great question. I mean, it's not without its challenges, is it, for sure? But I think we're making some great strides, and I think the clue's in the title there, which is that integration. I think it's important for the suppliers such as ourselves to bring together different parties. And when we look at connectivity, digital connectivity, we try and engage with a broader spectrum. So we try and move it from outside of the silos, because it's not nobody's deliberately thinking about silo healthcare, but that's how the budgets are split. I think it's within the gift of the suppliers to engage across that ecosystem, so that health ecosystem, and bring to life what that really looks like and what the ability of the solutions are as well, and ensuring that we get the right people around the table. And we've had some great examples of this with the work that we did with digital inclusion in the Leeds area and the O2 stores, where we were providing training for the NHS app, and we brought together all of the sectors that you're mentioning there, and we're on the call today with a few of them as well. So it's absolutely within our gift to be able to bring those parties together, and it's about talking it through, not always from I think trying to remove that somewhat fear, I suppose, of some of the organisations, that they don't want to engage with the supplier because we're just going to come along and sell them a gold-plated something or other. It absolutely isn't the case. We're committed to working with our partners and to build partnership. This is not a sell and run solution. This is about developing a partnership that we can evolve in time, and is that it's suitable for the future, because we are at the foot of the hill, really, in terms of digital healthcare. It's going to increase. As I said earlier, it's what's required as part of our total care package for patients, both in that community base and also in that secondary care environment. That to relieve that pressure, we need to take advantage of what is available through digital. So this is the beginning of that journey. It's not the only journey, but it's the beginning of another journey, another solution, and we do it in partnership, and that's what's going to work best.
And I know there's a lot of people on this call who'd love to be part of some of these partnerships, and hopefully this is the kind of thing that actually can kick off some conversations, particularly in public sector bodies. And Rachel, coming sort of back to Leeds, what lessons have really emerged for you from tailoring digital skills support, particularly for those people who maybe have complex needs or long-term health conditions, maybe they're experiencing disability? How have you tailored what you're doing to really meet these needs in depth?
Yeah, so we've worked really closely with those organisations that do support people with those additional barriers and needs, but really kind of like working on kind of upskilling people with lived experience. And we've sort of good examples of that, working with like really grassroots organisation groups that aren't even registered sometimes as a charity, because they're so kind of grassroots within the organisations and communities that have lived experience and are kind of people from the community themselves that really understand the needs of the community. So working really closely with them. We've done quite a lot of work with long-term condition groups. So really thinking about those additional barriers that people with COPD face. We did a piece of work supporting them around using the My COPD app, and just sort of working with the health services around actually how are they offered the tools, how does that conversation look? And we've done some kind of awareness workshops and training with staff to be able to support with those conversations. And where it can be quite overwhelming, where even the NHS app, there's lots of features and benefits on it. How do you actually promote it? How do you have that conversation with someone? Done lots of work around kind of focusing on kind of like one key benefit for somebody, so they might see that benefit quite quickly. Obviously understanding their additional needs and barriers as well within that, to be able to tailor that approach to that individual person. So there's not like a script as such in kind of how you actually explain about the tools. It's really about kind of finding out what that kind of, not necessarily pain point, but kind of what that challenge is that somebody might be facing. So there was an example of like Carers Leeds group, that there was a carer that was saying, it's really challenging ringing up, making my appointments on the phone, because I'm having to kind of like support the person I'm living with who lives with dementia. So really understanding it's the time factor. So being able to explain the benefits of doing things digitally to be able to save time. So working with the kind of obviously the health services and the workforce to have more confidence in being able to have those conversations. We had so many examples where some of the staff have actually said we haven't really been offering them, or we haven't really been saying much about them because we don't feel confident. If somebody then says, oh, I can't use it, or I would struggle, or I don't have a device, or I don't have Wi-Fi, that feels like, I think in their words, someone said like it opens a can of worms. And I totally understand that, because that means they feel like they're offering something that's not inclusive. So we're really working on helping the workforce have those conversations and them feeling confident in actually deeper understanding the need. And we've done a lot of work with the health trusts around screening questions, which sounds really formal, but actually it's just really informal, really looking at kind of what questions and conversations look like in, you know, what they're asking. And historically, probably many services might have some of these sort of like, you know, question forms or whatever you want to call it, surveys. There were very much yes or no answers. So it was like, can you, can't you, have you got a phone, have you got an email address, you know, do you use the app? And actually we've really worked with them to sort of change those screening questions to be more around, if you were to use, what support would you need? So like really thinking about kind of open-ended questions with those, obviously sort of to deeper understand digital inclusion need, rather than just people are in boxes, you can or you can't. Actually, if they were to, what is the barrier and what additional support might they need? And then actually helping with that signposting and referring to support in the community or within the practice, depending on what that need is. Also just sort of touching on Mark's point around social value. We've done a lot of work in Leeds and continue to do a lot of work working with corporate partners in the city. We've got some really, really good successful projects, doing a lot more around social value, doing big networking events, bringing the third sector and corporate together to be able to look at networking opportunities. We've done it a bit of a speed dating event. So it's kind of saying like what support they've got available and what is the need, and then coming together to co-produce an intervention so that actually whatever that offer of support is from that corporate company, that it fits for the needs of the individual organisations. And then just finally, like just obviously bringing funding in. Obviously, it's always a challenge to be able to seek funding. And we've learned a lot of lessons around kind of supporting organisations to be able to access funding. A lot of the time, it's not labelled digital inclusion. You've got to look a lot further around, you know, some of those wider determinants that it's supporting. But we do a big annual event called the Leeds Digital Ball, which is basically encouraging corporate companies to basically they pay for a ticket. It's a big event, and we raise money with the tickets for digital inclusion, and it's such a successful event in the city. And the fund has just launched actually yesterday. So we've got over £100,000 to be able to give out across Leeds specifically for digital inclusion. That's coming from the city. So to bring money in, obviously using the resource from obviously those companies. So yeah, lots conscious of time, but yeah, that's some of the examples anyway.
And I think it really is, it's that tailoring. It's making sure that you're not, as you said, Rachel, putting people in a box and going, right, so you need this intervention. It's actually listening to what people need. I'm going to move us on to some of the questions that we've had come in, because I think there's a couple of that it would be really good to just cover off, and I'll combine a couple of these. So Sylvia sort of has noted that infrastructure in towns and cities can be bad, but in rural areas, infrastructure can be almost non-existent. And Shanice has sort of asked, how do we particularly promote digital inclusion for people living in rural and coastal areas, which is very close to the DPA's heart, because most of the delivery work that we do is in those areas. And this is also something that's come up in our health inquiry. So maybe I'm going to come to Mark on this. What do you think would attract corporates particularly to want to work with VCSE organisations and also public sector bodies in these sort of non-city locations to crack the infrastructure and the take-up?
Yeah, I kind of felt you were going to come to me with that one. It's obvious. Yeah, I mean it's a challenge, isn't it, with connectivity sometimes. But what I can say on that is, as an organisation, not just ourselves but others as well, we're constantly looking at our connectivity. It's in our best interest, okay, from a corporate perspective, to make sure that we have the best available connectivity in as many rural and hard to reach places as possible. And on a yearly basis, that's been assessed and it's been improved. And you know, we're reaching more parts of the United Kingdom than we ever had done before, and that continue. We are absolutely aware of the importance of that, because it's a golden thread to all of our customers. It's a requirement. We are looking at ways in which we can improve. We are able to stand up in high traffic flow areas, because you would think it would only be in the rural environments, but actually we have connectivity challenges sometimes in the city centres at big event days and such like as that, where the capacity is such that we can't keep up with its standard format, and we can stand up intermittent connectivity systems that enable us to get better connectivity there and then. But rest assured, all I can say on this subject is that we are looking at things such as private 5G networks, 5G coverage, satellite, different types of satellite. I'm not going to mention too many names, but satellite opportunities that make it more accessible for people. It is the highest priority list for ourselves in terms of connectivity. That's how we become number one, and that's how we remain number one. So it is super important to us.
Sounds like a whole webinar in itself. I love it. Maybe that's one for later.
Not with me. It might be something a bit more. My background's healthcare, not necessarily digital technicalities.
No worries. And Meryl, I'm going to come back to you on this one, which is from Violet. That actually the average reading age of the country, Violet says, is stated as being approximately 11 years old. Digital literacy, evidently, literacy to be able to read and write is so important in accessing digital services. What resources do you think maybe would help to improve that barrier for people?
We're really well aware of that reading age, and it's something that we've been campaigning, especially in Manchester. We've just recently, all our practices have just overhauled all their websites, and it was done 2 years ago, over a period of time, through audit. So the reading age, we need to keep everything just simple, but not when you're talking to patients or when you're giving them information. You still need to treat them like human beings. And I think that's the most important point when you're communicating all this information over. But the reading age on some of this literacy is just way above the average reading age. And that comes again with, it's not just the digital skills, it's the educational skills of a lot of our patients and community. So it's been, how do we make sure that our services are accessible and patients can understand them going forward? So we're really aware of the reading age and the importance of that on all our guidance that we provide for the patients as well. Even some of the literature that comes out, from the NHS, it's still not in the average reading age, and it's getting that importance across the whole infrastructure that we need to support the patients with this across the board.
Thank you. And thank you everyone who's joined our webinar today. We could certainly have kept this going for at least another hour. We would absolutely love to hear any of your comments around these issues, particularly because we launched a couple of months ago our inquiry into digital exclusion and health outcomes. I've just dropped the link in the chat there, digitalpovertyalliance.org/health inquiry. If you have one sentence to share with us or you want to answer the whole form, we would absolutely love to hear as many insights as possible. This is a very wide-ranging inquiry chaired by Professor Farabati. We will be looking at everything from the app and ensuring that staff and clinicians have the skills and support that they need to promote digital inclusion, through to the urban versus rural divide, language barriers, misinformation, and anything else that you can imagine, alongside the obvious points around affordability of devices and data, skills, confidence, accessibility. So do make sure you fill that in. You can also find details on our website around End Digital Poverty Day, which is coming on the 12th of September. Make sure it's in your calendar, more details coming soon. And you can also find out how you can support digital inclusion work. So I know my colleague Imi posted some links earlier around our local authority network, our community circle. You can also find out how to sign our charter, or indeed donate devices or anything else you might want to donate to us if you like what we're doing and want to provide some practical support. Again, massive thanks to all of our panelists today, to Mark Burton at VMO2, to Rachel Ben at 100% Digital Leads, and to Meryl Merlins at NHS Greater Manchester. We will be having another webinar coming up very soon, which will be at the end of July. We'll be focusing on one login, so please ensure that you are signed up for that. And the last thing that goes for me to say is a big thanks to Virgin Media O2 Business, who are one of the supporters of the DPA, and we can only do what we do thanks to the support that we receive from different companies and different trusts and foundations. I hope to see you again on a webinar very soon, but thank you again to our panelists and attendees today. Goodbye, have a good rest of your day.